One of the cool things about science is falsifiability. It's the ability for other people in the scientific community and scientific field to redo an experiment that someone did and to come back with a different assessment saying this experiment seems dodgy, with other scientists to be able to join in to give a determining factor of yay or nay and whether something needs to be revised, changed, or outright thrown away. When you had something like Newtonian physics that seemed, for all intents and purposes, to be like the word of God, a mechanistic universe that's basically billiards, balls bouncing around and everything else, well, that made sense. It serves our experiential understanding of the world and the way that we operate. Then you get Einstein, who makes the point of saying, well, yeah, but is it that way everywhere all the time? And you find out, oh my God, it's not. And our human comprehension of that becomes somewhat difficult to do. Even though we can mathematically see it, it's kind of hard to wrap your head around the notion of time not behaving the way that we typically see time behaving, or for that matter, space not behaving the way that we understand space to typically behave. That's a good thing. Now, oftentimes, we don't see the sausage being made. Oftentimes, what we see is basically the after effect of this person had this idea, yada, yada, yada. Now we're using that idea for some tool, some technology, or for some particular scientific principle. Like for the relativity thing, basically our satellites. If we basically just kept our satellites based on Newtonian physics, our satellites would be off a little bit. That off a little bit has to do with this kind of notion of we're in a gravity well, that thing is not, and Einstein equations gives the correction for that. It also, to some degree, validates Einstein's equations. I hope you understand what I mean by this. We typically see this stuff at the endpoint, not at the point of through which the research and everything else is being done. We get to use all of the labor, all of the brain power that was put into all of these ideas and theories that take place. Right now, we're in the middle of a COVID pandemic. Now, COVID-19 has basically spread all over the world, but due to our political leaders wandering through a smog of incompetence, or for that matter, egotism and self-interest, they have allowed hundreds of thousands of people to die. That's not just right-wingers here in the United States, that's right-wingers across the world. They have been responsible for hundreds of thousands of deaths on their conscience. If we're being very specific to the United States, the same thing applies. Tens of thousands of deaths on their conscience. What I want to get to, though, is as we proceed through this pandemic, you have something happens. You have a scientific community that gets in gear to try to figure out what's going on, to figure out what's the culprit. And then through research over the course of the several months to figure out what is the best way for treatment, what is the things that deal with keeping the people safe themselves, in addition to trying to treat that particular patient and keep that patient and get that patient out alive. The treatments that are used on the various patients would improve just by the scientific method of them testing and then coming to some kind of consensus on whether or not something works versus something not work. The experimentations that's involved in it, meaning we're getting to see the sausage as the sausage is made. It's not magic. It is actual hard work where those people come away with a hypothesis, test it, yay, nay. Someone else does the same thing, test it, yay, nay. And your knowledge and whatnot expands as you proceed through that process. It's just a tool. It's not the word of God. Some people take it as, I believe in science. I have no idea what that means. It's like saying, I believe in a hammer. Yeah, I do believe in a hammer to knock down a nail, maybe not for something else. In this very specific case, people are being slightly perturbed because scientists are going through that process and things that reporters have jumped on and said, yes, this is what it is. And then later on, you find that there's a change or an amendment to it as the knowledge grows and expands. It can be aggravating because that becomes a political element to the way that scientists, especially if they're connected to any kind of administration official at all, sometimes behave and act. So, example, Fauci, giving somewhat of a misdirection in regards to masks, even though he did not lie, he told you everything that was in it, but whatever. He gives a misdirection because the country is low on masks. He didn't necessarily want people to be able to getting those things where nurses and whatnot needed those things. So his scientific advice was somehow curbed by his by the political need of the moment. But that doesn't necessarily mean that he's wrong, either for doing that or wrong in the way that he's pursuing his job. The World Health Organization is one of those organizations that is trying to get a grip on the virus. They're trying to update and keep relevant regarding the new information that we have on that virus, and updating its guidelines for the various countries to deal with that virus. They've just updated to something that may be significant, and so I kind of want to talk about it. The virus beforehand, when they would talk about it, they would say gloves and a mask. You're great. But a lot of that had to do with this notion that it was going to be on surfaces, not necessarily just kind of lingering and floating in the air. Well, that's changed. They're basically arguing and saying that there's emerging evidence that the virus is airborne and does stay airborne for a period of time, basically lingering. That gives a longer window of time for a person to inhale those droplets and basically get infected. I'm just going to read this. It's not long. This is Economic Times. And this is what I'm looking at. World Health Organization acknowledges evidence emerging of airborne spread of COVID-19. So, Tuesday, World Health Organization acknowledged emerging evidence of the airborne spread of the COVID-19 virus after a group of scientists urged the global body to update its guidance on how the respiratory disease passes between people. We have been talking about the possibility of an airborne transmission and aerosols transmission as one of the modes of transmission of COVID-19, Maria von Kerkhove, technical lead on the COVID-19 pandemic at the World Health Organization, who was saying this in a briefing. The World Health Organization has previously said that the virus causes COVID-19 respiratory disease to spread primarily through small droplets expelled from the nose and the mouth, an infected person, and quickly sinks to the ground. But in an open letter to the Geneva-based agency published on Monday, Clinic Infectious Disease Journal, 239 scientists in 32 countries outline evidence that they say shows floating virus particles can infect a person who breathes them in. Because those particles exhaled can linger in the air, the scientists are urging the World Health Organization to update its guidance. Now, the thing is, I'm not sure what else people could do at this point. People are basically wearing masks every time they go into a building. When they're outside, they may be somewhat different, but inside, they typically wear masks. So I'm not sure what other protections are possible. Maybe the point of this is to lean more heavily on this notion that, no, if you're out in public and you're going into some building, you need to wear masks. This is something that can infect you beyond the point of it being on a particular surface. And in my understanding, airborne diseases are that much more virulent in regards to their passage. And so if you have, let's say, an outbreak in the United States, and that outbreak is spreading all over, and you have people who may be migrating from point A to point B who may not necessarily have symptoms, they're asymptomatic, they could spread this disease in a way that have it basically lingering in the air. Those people at the stores that you see that are not wearing masks, when they leave, that virus could potentially linger. The question is, how long do those droplets hang in the air? But the fact that they're making this argument that, look, this virus is also airborne, gets across the potential problem. This is not a political statement. This is a health issue. And I understand that Donald Trump wanted to be cool and not wear a mask, and what's his name, Bolsonaro, wanted to be cool and not wear a mask. Bolsonaro's infected. Boris Johnson's infected. We're just waiting for Donald Trump to get infected. Apparently, he is terrified of getting infected of COVID-19, so they've been taking every precaution in the world to prevent Donald Trump from getting infected. Now, he's scared of it because of political reasons. Again, turning something that is an issue of health into an issue of politics. In this very specific case, the guidance that the World Health Organization is potentially going to update is specific to the notion of this virus now being considered potentially airborne. Like, share,